My name is Joe Jordan. I'm the CEO of the North Carolina Physicians Health Program. As the CEO of the Physicians Health Program, it's my job to make sure that everybody coming through that door is getting the help they need to get back to doing what it is that they love to do, which is helping patients. I began working at NCPHP in 2007. Prior to that, I was an ethics officer at the National Board for Certified Counselors, and prior to that I worked as a counselor. I had a counseling service, but probably the thing I enjoyed most was providing emergency evaluation and care for persons in emergency rooms and on hospital floors as part of the Moses Cone Health System. NCPHP is a private nonprofit dedicated to the idea that if medical professionals get appropriate care and concern and help, that they will be able to get back to work in a safe and effective manner while simultaneously dealing with whatever it is that brought them to PHP in the first place. What I like most about working at NCPHP is I get the opportunity to give people hope, to give people a way back to doing what it is that they love to do. Oftentimes when people come to a PHP, they're scared, worried, concerned, and feeling like they don't know where to turn. And being able to give that person a path back to doing what it is they love to do, giving them a path to recovery, that's what I like most about working here. We are extremely careful in dealing with anonymous cases. And the reason we're so careful is because we know people are scared when they come in here, and they're worried that people are going to find out that they have a problem. What we're going to do is make sure that people don't find out and work with them in a confidential manner to address these issues so that they don't have to be worried about that. If there was no Physicians Health Program or other health program for professionals, we would go back to the times that medical professionals just got sicker and sicker and sicker, to the point where not only they were too sick to take care of themselves, they were too sick to take care of patients. We want to avoid that. We want to reduce the stigma associated with mental health and substance use disorders and help people understand that just like everybody else, medical professionals sometimes need help. If someone is fearful about coming to the Physicians Health Program, I understand that fear. We all do. We're trained professionals, and we understand that it's scary sometimes to admit that, hey, I've got a problem and I need some help. What I would say in response to that fear is, you have nothing to be scared of. What we're going to do is help you figure out the next best step. And in doing so, we're going to get you back to doing what it is that you love to do and help you deal with whatever it is that you're calling us about in a way that's the best for you and for your patients. If someone is knowledgeable of a colleague that's having an issue with substance use, mental health, or just feeling burned out, I would ask them to go to that colleague and say, I know a place that you can get help, a place that is devoted exclusively to people in our profession. Or if they themselves are struggling, I would ask them to call, look on our website, talk to someone that's been a part of our program, but reach out, don't suffer in silence. I worked a lot of years in mental health and substance abuse, and I've seen a lot of people deal with a disease of substance use, disease of depression or anxiety on their own and with no help, feeling like they couldn't reach out to anyone, and as a result trying to take on something that was stronger than they are. Physician health programs provide an absolute wonderful support system for persons so that they don't have to address this problem by themselves. They don't have to do it alone. We can help them if they'll let us help them, and we will. People ask me why it is that I do what I do and why it is that I help the people that come to the Physicians Health Program. I've worked in the field of mental health and substance abuse since 1989. I've worked with all types of people from all walks of life. And the Physicians Health Program is the best model I've ever seen for helping people get back to being healthy, taking care of themselves, and in doing so, they have the ability to affect hundreds and sometimes thousands of people. What we do here is nothing short of miraculous. and I want to be a part of that.